Good morning, good afternoon, good evening, or good night. My name's Kaylee Pikett. I'm the lead midwifery clinical educator cross-site at Bedfordshire Hospitals. I'm here today to talk to you about the Newborn Personalised Care Plan. The Newborn Personalised Care Plan has been developed as a quality improvement project from our Maternity Incentive Scheme Year 7 Safety Action 3, which is keeping mums and babies together. We created a working party in March 2025 and the listed people have had involvement in this. So why did we choose a newborn personalised care plan? NHS England's long-term plan requires all service users to have personalised care and support planning. This is already established in maternity care for mothers and birthing people. But newborn documentation has historically been fragmented and added on rather than integrated. The aim of the plan is to enhance the newborn care package by integrating perinatal and neonatal services, ensuring clear, robust clinical pathways, supporting early identification and escalation of risk, improving short and long-term outcomes for babies. The booklet holds key newborn documentation in one place, which includes their background, so their antenatal history, their labour and birth details, their early details of resuscitation and their first physical examination. We then go on to assess their risk factors, so using our risk tools, so your Kaiser sepsis risk calculator, with our amber and red flags. If a baby has one amber flag, this baby will not require antibiotics, but it may still deteriorate. Therefore, we still need to do a full set of observations. Obviously, if it then has one red flag or two amber flags, it will need to have neonatal input to assess whether this baby will need to go on to antibiotics. We then have our hyperglycemia risk factors, and in this we have the addition of blood glucose screening. So 2 pre-feed blood sugars for these babies, but they should also carry the observations as well in the first 12 hours of life, because deterioration can happen. We also then have our feeding chart to give space to ensure that our babies are feeding well before discharge. And then we look into our jaundice risk factors. All babies at risk of jaundice should be assessed for jaundice before leaving the hospital and follow the pathways. We have our escalation for our NUT2 observations, which is now integrated in the document. We then go on to our screening, so our routine pulse oximetry screening for babies and our newborn screening, such as the newborn infant physical examination. We have then our pre-discharge review to make sure this baby is fit and well to go home. You may need to add additional documentation into the booklet, so we have an additional documentation page. You need to list the name of the document you're adding under its number, and then on the document where you put the addressograph label, we would like you to add additional page and the number of the page. This will let us know that there were additional pages attached and how many. Additional pages may include additional NUT2 charts if baby's on further observations, escalation tools for the NUT2, so our joint escalation tool, the perinatal optimization passport, any jaundice charts appropriate to age, or things like the neonatal abstinence scoring system. You may also notice there is no longer an amber pathway at either site. The amber pathway on the sites was different between the two sites and did not follow national guidelines. The decision has been made to go for a red hat and a green hat approach and have the observations appropriate for those babies. If the baby is on a green hat pathway, it will have observations at the first and second hour of life, which can be completed by a maternity support worker with supervision of a midwife to know the score and any actions required. The Red Hat pathway and babies on that will require observations at the first and second hour of life, which should be completed by a midwife, and then 2 hourly observations for 12 hours, which can be completed by a maternity support worker with supervision of a midwife, so that they're aware of the score and any escalations required. The only difference to that would be our hypoglycemia at-risk babies, which will also have the pre-feed blood sugars. Looking at the Red Hat pathway, there are different reasons that babies will be under this pathway. So it might be an intrapartum related risk factor, it might be a risk of a sepsis, congenital abnormalities, infants at risk of hypoglycemia, or any preterm babies. These pathways and risk factors have been pulled from all of our current active guidelines, which you can see listed to the side. And if you have any concerns about any of the pathways, please refer to your guideline and escalate any further concerns to your senior leadership team. We are happy to answer any questions that arise. Thank you for listening to this short clip about the Newborn Personalised Care Plan. As I said before, it's a quality improvement project and we would welcome feedback. Please also be aware that this is a stopgap between now and us receiving the Badgernet system, where all of this will be integrated, and once you document something in one area, it will transfer to other areas, reducing our workload, but it will still be vital. Thank you very much for listening.